Assessing a patient's continuing healthcare needs is often a time-consuming process with information gathered from multiple contributors and systems. Manual processes take time away from delivering care, with patients and their circle of care often anxious whilst they await the outcome. With Salesforce's digital continuing healthcare solution, you can get an overview of your caseload of patients at a glance, including any bottlenecks, outstanding documents, or issues that need your attention. Completing a patient assessment is a guided step-by-step process, with key patient information automatically pulled in from PDS and other systems. Save GP letters, MDT summaries, and other key documents against the patient record. Document patient consent with fully transparent and auditable data capture. Record patient health across key areas such as breathing, mobility, and communication, with patient acuity ratings automatically applied. Assessments can be saved for CHC teams to come back to later. A visual path highlights where a case team is in the process. Key milestones are visible to users and fully reportable, so it's clear what needs to happen by when. Documents can be summarized with one click, so key details are highlighted at a glance. Nurses can use an intelligent assistant to identify and execute workflow across a large caseload, such as assessments awaiting documents to be returned by health professionals ahead of an upcoming MDT date. Contributors can also be automatically reminded if they have outstanding tasks, reducing delays in gathering key documentation. Patients and their carers can be automatically kept up to date on progress with the assessment, providing reassurance and guidance at every step. A guided process steps teams through the final assessment, with MDT transcripts, documents and more, automatically summarized into the relevant continuing healthcare domains. This means that clinicians can focus on reviewing and editing the summary assessment and making their final recommendation, saving valuable time otherwise spent gathering information from disparate sources. Clinicians can reduce time taken to complete a CHC assessment by 30% by reducing manual steps, gathering information in one place, and leveraging proactive communications to contributors. Patients and their families are kept informed throughout and proactively guided on how best to prepare for the next step in their care journey.